Hello, welcome to Veterinary Medical Applications. Today I'm going to be teaching y'all how to take vitals on a dog. I'm Paige, this is Catherine, and this is Nash. Alright, first of all we're going to go over some safety rules. And number one is that you need to be wearing gloves because you don't want to spread diseases between other dogs and from dog to human. Secondly, you want to have two people. One person is going to restrain the dog while you're performing the vital tests, and the other person is going to perform the vital tests. This is important because you wouldn't want a dog to reach around and bite you or, to get away from you. Second, we're going to hold the dog away from our face because when you're performing these things, they're uncomfortable when you're in the back taking their temperature or in their face. They're not going to want you there. So it's important to have the dog away from your face so that they can't bite you. Alright, the first vital test we're going to do is the capillary refill. And for this, I'm going to have Catherine hold Nash. As you can see, she restrains him underneath his waist and underneath his head with his face away from her. I'm checking the capillary, so I'm going to come in, lift his lip, and I'm going to press down on his gum. His gum should refill within 2 seconds, and it did. So he's good. Catherine, why do we wear gloves?
Oh, to prevent the spread of diseases, Paige.
Yes, it's important because since I'm touching his saliva, he's trying to get away. But it's important since we're touching his saliva, we want to make sure that when we touch our own self, we want to take off our gloves, or with another dog, we're going to change our gloves. All right, secondly, we're going to check his respiration rate. And for that, we're going to back up so we can see. Sorry. Nash, lay down. Lay down. Lay down. Lay down. He's wound up. Okay, or we can check it out.
Yeah.
All right, so for this, you don't really have to restrain him because you're just checking his breathing. And each breath he takes, you want to count. And we're going to go for 15 seconds. 1, 2, 3, 4, 5. All right, he's only got 20 breaths per minute. We only went for 15 seconds. He had 5 breaths. You want to multiply that by 4. That's normal for a dog. The range is between 8 and 40. All right, lastly, we are going to take his temperature. And this is the most important safety-wise because the dog is really not comfortable with this because you have to take their temperature rectally. You can see Catherine, again, is holding his head away from her face and has him restrained with both arms. And I am doing the procedure. So first what we want to do is sterilize the thermometer. This is important, again, not to spread diseases because in a veterinary setting, you're going to be using a thermometer on multiple dogs. So I'm using alcohol with some gauze. Secondly, you want to use some kind of lubricant, and I'm using Vaseline. Catherine's holding the dog. You're going to lift the tail. They don't like this, and take the temperature. Okay. And Nash's temperature is 100.3. That is normal for a dog. A normal temperature for a dog is 99, so 102 degrees. So, Catherine, once again, why did we restrain Nash?
So he wouldn't reach around and bite me.
Right, because you could see he was very uncomfortable. All right, that's all. I hope you learned some safety while checking vitals. The last thing is, we have another dog, but you want to change gloves in between. You want to sterilize the thermometer again. Just make sure everything is sterile, everything is brand new when you start over with a new dog. Thank you.
Deborah.